Good afternoon, everyone. This is Cassandra Taylor from Top Flight Defense Incorporated, and I'm here today with Mr. Shack. How about that?
Uh,
Shabazz Shack?
Shaz
Okay.
Shakir, that's good enough.
Shaz Shack. Okay. And we are talking about Social Security Updates 101. We will also go into some benefits and help for veterans as it relates to Social Security. So, Mr. Shack, go ahead.
All right, thank you, Cassandra. So pleasure to be here. My name is again Shaz Shakil. I'm a public affairs specialist with Social Security. So today we are going to be sharing some critical information. It's aimed to educate you on the Social Security programs and the different benefits that we have. I'm also going to update you on the current affairs, right? So lots has changed this year, primarily. We've switched to appointment focused service where generally, if you want to come into the office, you have to have an appointment made depending on what it is that you need to do. So I'm going to kind of give you the information that you need about that and also share some technical information with you about retirement and disability and Medicare. So before we get started, I do need to mention because this is being recorded, obviously the information that I'm sharing today is accurate or effective as of June 11th, 2025. And then just keep those disclaimers in mind. So what I will do though, before we get into the technical stuff, I will talk first about something called a My Social Security account. So this is your personal Social Security account where you can access all of your information. You can do about 95% of your Social Security business, in my opinion, online. Okay. Filing for retirement, filing for Medicare, filing for disability, filing for SSI. You need to get a benefit verification letter. You need to get a replacement Social Security card. All of those services can be done through your My Social Security account. Um, so part of our focus and part of our agency goals now is to get everybody signed up and enrolled for a My Social Security account, right? The last thing you want to do is go to an office and have to wait 2, 3 hours for a piece of paper or your benefit letter to show your landlord when you can easily access your account and get your benefit letter in a few clicks of a button. So I'm gonna first, again, starting off our little presentation here, I do want to encourage everybody and you know, tell everybody that making a My Social Security account is the first, easiest, best step you can do for yourself. So there's plenty of things you can do on your My Social Security account if you're getting benefits, and there's plenty of stuff you can do even if you're not getting benefits yet. So obviously, if you're getting benefits, there's a bunch of stuff you can do, including changing your address, changing your direct deposit, right? You don't want to have to call the 1-800 number and be on hold, for a couple of hours to change your bank account. You can go online and do that yourself. Getting your 1099 tax statements, all of that information is available through your My Social Security account, right? And then even if you're not getting benefits just yet, um, you can review your earning estimates. You can apply for benefits online. And at the very least, you can at least review your earnings every year, right? So at the close of every year, you can go in and make sure your earnings that are getting posted every year are correct and then kind of flag that, make sure there's no fraudulent stuff going on, right? That's the very least you can do through your My Social Security account. So again, your My Social Security account is personal to you, right? You're going to create it through our website, and then you go in through login.gov or ID Me. There's a few different ways to create an account, but it's personal to you. You put in your Social Security number, they text you the PIN and password, and it's your account, right? Nobody else's information is on there, and nobody else should be able to access it. So I just wanted to start with that. So what I'll do next is I will start talking about some of our benefit programs. So Cassandra, what you may do is as questions come up, just tell me to take a break and hey, we have a question and I'll answer it as I go along and we'll see how much information we can cover in the hour. So folks who are asking questions, please do not put your personal information on the Facebook live chat, or please don't, say your personal information out loud, like your social, your date of birth, name, and address. Just ask a general question, in general layman's terms if you can, right? If somebody has an overpayment, what should they do? Don't tell me that you have an overpayment and, go into the details of your case. Um, so the first thing that I do want to mention about, again, Social Security benefits is Social Security administers two different programs. So we have Social Security benefits, right? That these are the benefits that folks will refer to as SSA or Social Security benefits. We also have something called SSI benefits or Supplemental Security Income. So these are two different programs. Social Security benefits are sometimes called Title II benefits. SSI benefits are sometimes called Title 16 benefits. That just refers to, which section of the Social Security Act those benefits rules are written in. So again, there's SSA benefits and then there's SSI benefits. Uh, Totally different rules and totally different eligibility factors for each. And I'm going to talk a little bit about each, but I just want you to kind of understand those two differences and kind of keep those in mind as we're going along here. So, Social Security benefits or the Title II benefits, these are the ones that are based on individuals working and paying Social Security taxes, or FICA taxes is what they're called, right? So the Federal Insurance Contribution Act. So if you're working for a salary and getting a paycheck every 2 weeks, this FICA tax or OASDI tax is what it's going to show on your paycheck. That's being deducted from your wages. So the total FICA tax is a little over 15%, right? Over here, it's showing you that it's 15.3%. So out of that 15.3%, you pay half of it, which is 7.65, and your employer pays the other half, which is the other 7.65. Okay. And then that 7.65 further broken down, 6.2% is going towards your Social Security benefit amount. This is the dollar amount, the check amount that you get. And then another 1.45% is going towards your Medicare. Okay. So, folks who, again, are working for a paycheck, this is being deducted from your paychecks every weekly or bi-weekly. Folks who are self-employed, they file taxes once at the end of the year, right? On their net profit for whatever their business is. So they would pay the entire 15.3% on their net profit, right? Because they are the employer and the employee in a way. And then that's what goes down as their earnings for that year, depending on, they made 40,000, 50,000, 100,000, whatever you made. That's what goes down as your income for that year. So that's what the FICA Social Security tax is. So somebody's been working and now we're thinking this an individual is going to get retirement benefits. How much does somebody need to work, and when can you start your benefits, and how do these credits and quarters, how does that all add up, and what does that all equal to? Okay. So to get Social Security benefits or Social Security retirement benefits, you have to work a minimum of 10 years and earn a minimum of 40 quarters or 40 credits, you can call them. So you can only earn up to 4 credits or 4 quarters in a given year. Okay. So again, those 4 credits times 10 years gets you the 40 minimum quarters or credits that you need. So you don't have to earn a whole lot to get these credits or get these quarters. So in 2025, this year, if you earn $1,810, you'll get 1 credit. Okay. So that 1810 times 4, which is 7240. If you earn 7240 in 2025, you'll get all 4 credits for this year. Okay. You don't have to necessarily work the entire year. If somebody works over the summer 3 or 4 months, working at all the Cubs games or something, and they earned 7,240 bucks just in the summer months, they'll get all 4 credits for this year. Okay. But you can only earn a maximum of 4 credits a year. So if somebody makes 50,000, 75,000 for the year, you're only getting a maximum of 4 credits. So to get Social Security benefits, again, you have to have a minimum of 10 years of work. But when we're calculating your benefit amount, we are going to look at your highest 35 years of earnings. So if somebody has only 10 years of earnings or 12 years of earnings, that's fine. But you're going to sort of have, 20 or 15 years worth of zero earnings kind of built into the calculation. Okay. And I'm going to kind of explain what that means. So when we're calculating your benefit amount, the first step is we have to get your average indexed monthly earning. Okay, so AIME, or your IME amount is what we call it. So how that amount is calculated is we take your highest 35 years of earnings. Okay, so before we take your earnings, we do something special called indexing those earnings. Basically, we're adjusting what you made to kind of more accurately represent what those dollars are in today's dollars and cents, right? So if you worked from 1980 to 1990, and those were your 10 years, and you made 10,000, 12,000, 14,000 a year for those 10 years, when we're counting those earnings to calculate your benefits in 2025, we're not going to count 10, 12, or 14. We'll count something a little higher than that after we adjust for this indexing that we do. Okay. So we add up all of your earnings. So if somebody worked, 10 years or 12 years, and let's say their total earnings add up to 1 million versus somebody who worked 30 or 35 years, and that person's earnings added up to, let's say, 5 million, again, throughout their entire life. We take your total earnings and then we divide it by 420. Okay, so for even the person who worked the full 30 or 35 years, we take those earnings and we divide it by 420. This is the number of months in 35 years.
I was just about to ask that question. Where did you come up with that 420?
So
But okay.
that's the number of months in 35 years. Okay.
Okay.
So once we take your total earnings divided by 420, that gives us your average indexed monthly earning amount. Okay. That's step one of getting your retirement benefit amount calculated. Now, from that average indexed monthly earning amount, we do some math with it, right? So now we're going to look at what that math looks like. So this example is based on somebody's average index monthly earning coming out to $8,000, let's say. Okay. So somebody whose average monthly index earning is 8,000, he or she will get a check of right around 3,100 a month, a little more than $3,100 a month. Okay. So how is that calculated? What we do is, of your 8,000 average monthly indexed earning, the first 1,226 of it, you're getting back 90%, which is 1,103. The next 6,000 or so of your 8,000 average monthly index earning, you're getting back 32%, which is 1,973. And then the last remaining 609, you're getting back 15%, which is giving you 91. And then all these amounts are adding up to your benefit amount. Okay.
Shaz, I do have a question. The majority of the people that are on my feed right now are veterans.
Okay.
And one of the questions that came up, they keep getting denied for their benefits. So I know that there's Social Security disability income. Are you going to discuss that later?
Yes,
Should they wait on that?
Yep, I will get to disability in maybe 10 minutes. At 4:30,
Okay.
we'll be on disability. So
All
I'll
right.
get
I won't stop you anymore.
Yep, no problem. So yeah, so again, this is your retirement benefit amount calculation. Disability, the rules are a little different. We'll talk about that in a second. Okay. Now, what I do want to highlight about this is let's imagine somebody's average monthly index earning is $2,000. Okay. So this individual whose average monthly index is 2,000, that person earned a whole lot less than what this $8,000 person earned, right? So you had either fewer years total working or you had a much lower paying job, right? You earned about a quarter of what this person made. So this person whose average monthly index earning is 2,000, this person's benefits are going to be calculated the same way. So they're still going to get back 90% of their first 1226, which is 1103, and then they're going to get back 32% of the remaining 700 and, $70 or whatever to give them another couple of $100. So this person's benefit amount would be, right around 1,300 or $1,400. So again, the Social Security program, it's been around 90 years, but it started in 1935, right? When there was a lot of income insecurity, right? Right after the Great Depression. So it's sort of designed to give a livable or a better benefit amount to even lower working or lower salaried individuals or somebody who didn't work a full 35 years. It's kind of given more bang for your buck for somebody who didn't work a whole lot or earned a whole lot less because of the way these benefit amounts are calculated. Okay. Um, Now, just a couple of other quick points about retirement benefits, and I'll get into disability. Um, Having enough work and those 10 years of work is one thing. The next thing for Social Security retirement is you have to be old enough to draw your Social Security retirement. Okay. So the earliest you can start is age 62. You got to be at least 62 for the entire month. Um, Now there's a very special age for folks called their full retirement age. Okay. So there's a lot of misconceptions about what full retirement age is. Is it 65 for everybody? Is it 66 for everybody? It's not the same for everybody. It depends on which year you were born. So if you're born after 1960, your full retirement age is 67. If you're born in the late 50s, depending on which year you were born, your full retirement age might be different because around this time, the laws were changing for what full retirement age is. So after 1960, it's remained 67. All right. Now, your benefit amount is based on how much you worked and how much FICA taxes you paid, and then when you get your benefit started. So this example is based on somebody's full retirement age being 67. That individual, let's say, would draw $2,000 at their full retirement age. Okay. If that individual wanted to start their benefits, as early as 62, they're able to do that, but you can see that the benefit amount they would get is $1,400. The benefit is reduced more heavily based on how early you start, right? Because the understanding is if you start at 62, we're going to pay you this $1,400 check 60 times before you get to 67, right? For these 5 years, you're going to draw this benefit. You're going to get that check 60 times before you get to 67. So the trade-off sort of is when you get to 67, your benefit amount is not going to jump up to that 2,000. It's going to remain 1,400 plus, whatever cost of living increases you see over the years. If this person wants to draw a check for 2,000, they would have to start their benefits at 67. Okay. Now, on the same token, you can delay your benefits and start your benefits after 67. And for every year you delay, you would see a little bit of an increase to give you a benefit amount that's more than what your full retirement check would be, right? So if this person delayed 1 year and said, I want to pick up my benefits at 68, so they would, again, be passing up $2,000 a month for 12 months. but at 68, they could pick up 2160 a month. Okay, that's how your retirement benefits kind of work in a nutshell. And then the
Um,
other quick note, go ahead, Cassandra.
Shaz, one other question or statement. Can't our can't people see this information on the my account? If they check into my account, they will see in that letter, it will show them how
Yes,
much their age and everything.
absolutely.
I know that it is, but I'm just putting
Oh
it
no,
out
no,
there
that's I'm
to
glad they asked
encourage.
because exactly this information will on right on your main landing page on my SSA. It gives you this information. What your benefit would be. Let's say you got disabled today and filed for disability today versus what you would have coming at 62 versus what you would have coming at 67, specifically for yourself based on how much earnings you have. Okay.
Yes.
Um, Now, one other quick note about benefits. This full retirement age date is important for two reasons. One, I just explained as far as how the benefit is calculated based on when you start your benefits. The other reason is if you decide to get your benefits started and you are going to keep working, it depends on if you're starting your benefits early, meaning before your full retirement age, or you're starting your full retirement age or after. So if you start your benefits early and you decide that you want to keep working, you would be subject to an earnings cap as far as how much you're able to make from your job during those years. If you start your benefits from your full retirement age or after, there's no earning cap, meaning you can get your full check and work and make as much money as you want, and there's no issues as far as getting overpaid or anything like that. Okay. So that's the last thing I will mention about retirement benefits. There's other stuff that gets into it, but I'm gonna jump to disability next. Okay. Um, so Cassandra, I'll share these slides with you afterwards and you can share them as you need. But let me get into disability next. So for disability, it's important to understand, again, there's two different disability programs that Social Security administers. There's SSDI or Social Security Disability, and then there's SSI or Supplemental Security Income based on a disability. So those two programs are very, very different. And I'm going to explain the differences here in a second. But to qualify for either of them, the definition of disability or the definition of what qualifies you for the Social Security disability benefits is the same for both programs. So, in a nutshell, you have to have a medical condition that's expected to last at least 12 or more months, or God forbid, result in death, right? And that medical condition has to prevent you from working substantially. That's the key part there. So some folks might have a disability. Let's say, somebody in their 30s or 40s, you have attention deficit disorder, or you have depression, or some sort of, cognitive disability. But you're able to take medication and work 8 hours a day, right? That disability may not necessarily be preventing you from working, right? That's the part that they look at. So you definitely have a disability. You definitely have medical evidence that shows you have a particular ailment. But is that disability preventing you from working substantially is the key part here. And what exactly is working substantially? That substantial word, it's usually a dollar amount that's set in place each year, right? Substantial gainful activity or substantial gainful employment. So this year, I believe that substantial amount is around 1620 or 1630. Um, Last year it was 1,550. So if you're able to work and make more than that amount, right? It's going to be determined that your disability is not preventing you from working substantially. So you would likely not be approved for Social Security disability benefits or SSI disability benefits, right? So that definition of disability is the key part to keep in mind. Now, the two different disability programs, Social Security disability This is the benefit that folks who are working and paying Social Security FICA taxes, Social Security disability insurance benefits are the benefits that they would apply for. So the example that I kind of want you to keep in mind to get an understanding of what Social Security disability insurance looks like is, imagine somebody starts working at age 20 or 25 or right or 30 whenever they enter the workforce, and they work 15, 20, 25 years. And now I'm 40 or 45 or 50 and I become disabled now. And I've definitely been working and paying FICA taxes this whole time. I definitely have all my 10 out of 10 quarters or whatever it is that I need. But now at age 50, I can't work anymore because of my disability. So what do? Right? I'm too young to draw retirement benefits based on my earnings. I'm not 62 or 63 yet. So that person would apply for Social Security disability benefits. And if they were approved for SSDI at 40 or 45 or 50, they would start drawing that same full retirement check that they had coming as a full retirement check if they continue to work until their full retirement age. Okay. That's what Social Security disability insurance is. So, sort of the technical stuff about Social Security disability is there's certain work tests that we look at. So, how much work do you need to have to get Social Security disability? It's not the 10 out of 10 quarters or the 40 quarter type of situation. It's different. Um, the difference is there is a recent work test and then a duration of work test that you have to meet to qualify for Social Security disability insurance. So let's say somebody starts working at 23 or 24 right after college and they become disabled at 30. Okay. If that person wants to file for Social Security disability, they might have enough work to qualify. But we're not going to look for that person to have 10 years of work. We might look for that person to have 2 out of the last 4 years, or 3 out of the last 6 years, or 5 out of the last 10 years, right? So there's two different work tests that we look at. Um, on the same note, let's say somebody starts working at 25, they work 10 years and become disabled at 35. Okay. But that person doesn't file for Social Security disability. And now they're 45, 10 years later, they say, hey, I want to file for Social Security disability now. That person may not satisfy the recent work test because you stopped working at 35. You should have filed for your Social Security disability at 35 if the reason you stopped working was in fact your disability, right? From 35 to 45, you were not working and you're waiting 10 years to file for Social Security disability. It's going to seem as if the reason you stopped working at 35 may not be because of your medical situation. So, where veterans may come across this is you worked in the 80s or 90s, right? And then you stopped working and you may have started drawing VA benefits. And then now 10 years later or 15 years later, you say, hey, let me try to get Social Security disability benefits as well. Your recent work test is no longer active, right? The last time you worked was in 2010. So based on that, you're no longer insured or no longer fully vested for that disability, Social Security disability benefit because that time frame lapsed in 2013 or 2014 or 2015. So this,
Shaz,
go ahead.
yeah. And this is why I've been doing this, having you all come on, because veterans don't understand that once you get out, you can still apply. And one of the things, and I probably step on your toes with this, and I apologize, but I gotta say it while it's on my I'm thinking of it. If they get out of the military or they retire at 100% disabled and they're total and permanent, they need to file for their benefits, and we get pushed to the front of the line. And I say this only because I did it and
Yep.
I got approved through it. But I had to, I stopped when I stopped working the other job. That's when they backed up to that other job because I applied soon as I stopped working. So thank
Right.
you for making that example,
Yes.
because when I put this back out there, they need to understand that you all are going to look at that 10-year gap
Right.
that they didn't do anything.
Right. So
Thank you.
either when you stop working or you can no longer work substantially, right? So if now because of my disability I can only work 10 hours a week and I'm making only $1,000 a month, you may qualify for disability starting that month, right? Whichever month
Mm-hmm.
your disability prevents you from working either completely or prevents you from earning that substantial amount, right? So this recent work test and duration of work test, this is what you want to keep in mind. So like the technical nitty gritty of this, I'm not gonna go through all the numbers in that sense, but we will check this for you. We'll know whether somebody is insured or has enough recent work and has enough total work to qualify for Social Security disability, right? You tell us when your disability started, you tell us your date of birth, we know how old you are, and you tell us when was the last time you were working, and we run the numbers and say, okay, this is your window to apply for this Social Security disability, right? So that's something super duper important. So that's where folks will get into trouble sometimes with that, right? So another time we'll see it is if somebody gets disabled or gets injured at work and then they file for workers' compensation and then they get those workers' compensation benefits for 4 or 5 years. They're no longer working. And then they file for Social Security after the 5 years workers' compensation benefits finish, then it might be too late for Social Security disability. Okay, then whatever earnings you've had up until that point, and whatever earnings you've had as far as FICA taxes that you paid, you're gonna have to wait until your retirement age to draw that as a retirement check, then, right? Because it's again the same earnings that you paid into Social Security. You're either drawing it as a disability check or you're drawing it as a retirement check. It's the same taxes that you paid and the same benefits you have coming your way. It's just how you become eligible for it. All right. Now, this is very, very different. Social Security disability benefits, these are very different than SSI benefits. Okay, so I'm going to sort of transition to what SSI benefits look like here. So your Social Security disability benefits, your dollar amount here could be different, right? For everybody. This could be 1,500, this could be 2,000, it could be 2,500 because it's based on how much you were working and how high or low salary or income of a job that you had. And it's based on how much Social Security taxes you were paying on your job. SSI benefits, on the other hand, there's no work requirements for SSI. You don't have to have any recent or total work done to get SSI, right? You obviously, one, either have to be disabled or you can get SSI if you're over 65. That's those are the two ways to get SSI, right? But SSI is a needs-based program, meaning you have to either be disabled or over 65, but then you have to show that you need the SSI income because you are very low or very limited income and resources, meaning you don't have money sitting in the bank account, you don't have any income coming in as a pension check or as a VA disability check or any income at all, basically, right? So SSI, Cassandra, go ahead.
Okay, I'm sorry.
It's okay.
I'm back over here once again, finally on this SSDI, and I'm gonna leave it alone. Um, for the veterans, like I said, because I have a bunch of them on here. If they are disabled, 100% total and permanent, at the age of 55 and say their retirement age is 67, and they will be getting $2,300 a month if they worked until the age of 67.
Right.
If they get approved for Social Security disability income, will they? I think I know the answer, but I need you to plug it in. Will they receive monthly what they would have gotten had they worked till 67, and explain why?
Correct. Yes. So they will. So again, at 55, whatever work they've done until 55, based on all that work, whatever their full retirement age check, meaning your unreduced check, right? Unreduced because it's not reduced for age. So your retirement benefits, if you start at 62 or 63 or 64, those benefits are reduced for age. So we literally count how many months before your full retirement age did you start. This person started 31 months before their full retirement age. So your check is reduced by 31 of these factors, right? A disability check, a Social Security disability check, does not have any reduction factors in there. It's your full retirement check that you would have had coming at 67 based on whatever work you did up until that point. You'll start drawing that as a Social Security disability check upon approval of your Social Security disability claim. Okay. And then you remain entitled to Social Security disability benefits unless you go back to work and start working more than that substantial amount, right? Or you're no longer disabled, where we have a medical review on you every 3 or 5 or 7 years, and that medical review returns that, hey, this person is no longer disabled. Those are the only two ways a disability benefit check can stop, right? During your lifetime. Obviously, once you decease, they stop, but during your lifetime, there's two ways the benefits stop. Either we consider you're no longer disabled based on your work and you're working more than that limit, or we consider you're no longer disabled based on your medical reviews that come up, right? So again, yes, you're correct that it's your unreduced check based on whatever Social Security and FICA taxes you've had paid up until that point.
Okay,
All right,
thank you.
no problem. So again, that check could be 1,000, 2,000, 3,000, depending on whatever Social Security taxes you've paid up until that point. Now, again, very different from SSI. So the SSI check, this is $1 amount that anybody on SSI, that's the most you're eligible for. So for 2025, the most anybody can get in SSI is 967 for an individual. For a couple, it's 1450. So there's different rules about couples, but I'm not going to get too into that. But for an SSI individual, whether you're qualifying based on a disability, whether you're qualifying based on age, the most you can get, again, is 967 a month. But you qualify for that 967 a month by showing that you have very limited income and limited resources. Okay. So income, for purposes of this presentation, if you're getting a check from the VA, right, that counts as income. So if that VA check is anywhere close to 967 or more, it's going to basically nullify any SSI you could be eligible for, right? So we'll count that as income. Or if you're working and making $300 a month, that $300 in income is going to cut against that 967. That's how SSI works. Okay. And then also you have to have very limited resources or assets, basically. So the limit on how much assets you can have for an individual is only $2,000. So if you've got more than $2,000 in the bank, you're not going to qualify for SSI, right? That's how SSI is very strict in that sense. So when we do an SSI application, there's a whole list of about 30 different types of resources we ask for: bank account, cars, houses, stocks, jewelry, you own a expensive baseball card collection, like all of that stuff kind of gets factored into SSI calculations. So you have to be very, very limited income and resources to qualify for SSI. Okay, so again, the medical part of it is the same, right? Disabling condition that's expected to last 12 or more months. Um, but then for SSI, you got to show limited income and resources. All right. So that is disability in a quick little nutshell. We have a few minutes left. I do want to touch on Medicare, but Cassandra, go ahead. Do you have a question? Oh, you're on mute. You're on mute. You're on mute, Cassandra. You might have to unmute yourself.
Okay.
Yes.
They wanted to apply for Social Security disability, but they have a dependent child who is getting SSI.
Okay.
And they gave them a hard time because they what they received. Oh, I take that back. Okay, so they have their dependent child who is an adult with disability.
Okay.
They receive dependent um money from the government because they have a disabled child. Social
Okay.
Security then reduced that child's amount of income because they said the parent is receiving money, but the
Okay.
parent is not receiving money for that child is because of that child.
Okay, so that's a good question. Now, if that child is over 18, right,
Yes.
it's considered an adult, right? We just consider that person as an adult SSI recipient. So for children who are under 18, they don't have their own income and resources. So if you're under 18, we look at the income and resources of the household of your parent,
Mm-hmm.
the one parent or two parent household, we look at that. Once somebody turns 18, they're considered their own adult person, and we look at that person's own income and resources, right? So unless that check is payable to that adult, him or herself, that's how they would count it against the child. So it depends
But they
though, like
didn't do that.
where,
Yeah,
well,
they
I mean, if
they did
they're
not do that. And the only reason I'm like I said, I'm with it because that individual is on and they asked me that question privately.
so I mean
Um,
that happens, right? So if income and resources are counted incorrectly, like it's something called a redetermination on your SSI claim. So we do dozens and dozens of those every day, right? To get a more accurate, correct understanding of what somebody's income and resources are. So if that
okay.
person thinks that the kid's SSI check is incorrectly reduced because we're counting income against the child that is not the child's income, we would need to do a redetermination and possibly correct that. But
Okay.
again, we do look at, there's a lot of stuff they look at, like, is that child living on their own? Are they paying rent? If who's paying for, other needs? So if the child is showing that I don't have any rent obligation and the parent is paying their rent, like all of that stuff kind of comes into play.
Okay.
So just, one thing like that, it's obviously worth talking to one of our offices about, but just kind of understand that they look at every little thing like that for SSI. But generally those income and resources for an adult child, once you're over 18, it's whatever you have coming for yourself. There's no more deeming of your parents' income to the adult once they're over 18, if that kind of makes sense.
Okay.
Okay.
Thank you.
No problem. All right, so gonna talk a little bit about health insurance. So Medicare is the federal government's health insurance, right? For folks who are over 65, or if you get SSDI benefits for at least 2 years, you get Medicare. So this is all that fun A, B, C, Part A, Part B, Part C. This is what Medicare is. So I'm going to kind of talk a little bit about that. So again, this is very different than Medicaid, right? Medicaid is the state government's health insurance. So that's the one that usually folks who are on SSI, because they're low income or low resource individuals, they would qualify for Medicaid, which is again the state health insurance for lower income individuals, right? So Medicaid and Medicare, they sound very similar, right? I don't know why they did it that way, but that's how they did it. So very different, and I'm going to kind of just highlight some of the differences between the two. So Medicare is again the health insurance that the federal government gives you, either when you're over 65 or after you get Social Security disability for at least 2 years. So again, Social Security disability, that's this benefit, the one that's based on your earnings. Okay. So after you get that for 2 years, like let's say your Social Security disability starts at 40, at age 42, you'll get that same A and B health insurance that you would have had coming at 65, right? Or again, when you turn 65, you get Medicare based on age and based on turning 65. Now, as far as when to sign up for Medicare and what all that stuff looks like, so when you turn 65, that is your initial enrollment period. So your initial enrollment period is a 7-month window during which, if you're eligible for it, you should sign up for Medicare, right? So the month you turn 65 is the middle month. So you got 3 months before, the month you turn 65, and then 3 months after. This is your 7-month initial enrollment period window. Okay. So if you sign up during this time, your Medicare would get started timely and there would be no penalty situation coming up, right? Now, where veterans, I would say, perhaps get into trouble is sometimes they'll not sign up for the Medicare at 65 because they have the VA insurance. And then later on, 5 years later, they're like, hey, I want my Medicare also. So they might get into trouble with having to face a penalty with that. So I'm going to kind of explain how and why that penalty comes up. So Cassandra, did you have a question?
No, I don't know. I'm agreeing with you out loud.
Okay. So if somebody at 65 is still working and they have health insurance from their job, or their spouse is still working and they have health insurance from their spouse's job, they can theoretically not take their Medicare during their initial enrollment period and kind of delay signing up for Medicare and sign up during a special enrollment period. That special enrollment period, basically, whenever you stop working or whenever your spouse stops working, you sign up for the Medicare at that time without a penalty. You would just obviously have to show us that you had health insurance from your job from 67 until 70. Let's say you work an extra 5 years, and then you pick up your Medicare at 70 and you have no penalty, right? Because you have the health insurance from 65 onward from your job. Okay. So you're this little 7-month window, you're basically just kind of delaying it until you stop working or until your spouse stops working. That's the special enrollment period. Now, if folks don't sign up during their initial enrollment period and they don't have coverage from their job or a spouse's job, they would have to wait until the general enrollment period to sign up. And the general enrollment period is the first 3 months of any given year. And that's when you would need to sign up for the Medicare. Okay. And the general enrollment period is when there would possibly be a penalty for somebody. Because how that penalty is calculated is we count basically every full 12-month cycle from the time you turn 65 until when you actually sign up for Medicare. And there's a 10% penalty for every 12-month cycle. So let's say a veteran at 65 doesn't sign up for their Medicare, right? They have VA insurance. they're getting a VA pension check. They say, I don't need my Medicare. They just forget about it, don't sign up for it, right? Now at age 75, 10 years later, they say, you know what, I need my Medicare. So you're able to sign up for it, but one is you're going to be limited to waiting for the general enrollment period of any given year, right? So right now we're not in the general enrollment period, it's June now. So if somebody didn't sign up for 65 and wants to sign up for Medicare today, and they don't have health insurance from their job after 65, they're going to have to wait until January 2026 to sign up for it. Okay. And then the other thing is every 12 months that pass from 65 until you sign up, let's say at 75, this is 10 years, right? So you would get a 10% penalty for every year you delay, which is 100% penalty on top of the Part B premium. So how this penalty works is whatever the Part B premium is. So this year the Part B premium is $185 a month. So if you have a 10% penalty, you're paying the 185 plus another 1850 on top of it every month for the rest of your life, as long as you have that Part B coverage, right? You have 100% penalty, you're paying 185 times two, basically. You're paying 185 plus another 185 in penalty, as long as you have the Part B. Okay, so that is what's sort of critical for veterans is if you're refusing to take the Part B at 65 and you don't have coverage from your job or your spouse's job, just be very, very sure that you're not going to need the Part B later on. Because if you do need the Part B later on, you may be subject to a penalty depending on how later on you sign up for the Part B. Okay. Um, and in the last few minutes that we have here, I'll quickly talk about what this A, B, and C is. So Part A of health insurance is hospital insurance. So this covers inpatient care facilities at inpatient care at hospitals and like long-term care that you may need later on in life, like hospice care or a skilled nursing facility. So for folks who have their 40 out of 40 quarters or have enough work, they get this Part A for free. Okay. So when you turn 65, you want to go ahead and take your Part A. The Part B of your health insurance, this is the one that has that 185 penalty added onto it. Okay. The Part B of your health insurance, this is sort of your meat and potatoes of your health insurance, what you would normally consider health insurance for outpatient care. It covers some medication, a regular eye exam, that kind of stuff. This is all under Part B. So Part B is the one that folks may refuse at 65 and then need to pick up later, during the general enrollment period or during the special enrollment period. Okay. That's what A and B is. There's a Part D of Medicare, which is extra coverage for prescription drugs. And then you might notice that I went from A, B straight to D. What happened to C? So C is a little bit kind of a mystery to folks, but I'll kind of explain what the C situation is. So when you sign up for Medicare, you're either picking original Medicare, which is on the left-hand side here, A, B, and then you're picking up a D plan if you want, or you're picking Medicare Advantage, aka Part C, which is a combination of an A, B, and D package all in one. That's what C basically is. It's called Medicare Advantage. Okay. So, if you're ever at like a health fair or a benefits fair, like you might see folks from private health insurance companies, they're usually signing folks up for their Medicare Advantage plans. That's what they're doing at those fairs. So that's a quick little rundown of what Medicare looks like. So I will end there because I know we're approaching 5 o'clock. Cassandra, I will email you the PowerPoint that I used today from the office tomorrow. and then you can share it and as you need. And then I don't know if there's any questions, if anybody has any like specific stuff related to their case and they want me to take a look at it, you can share my contact information with them and I'll happily call them and kind of talk to them one on one and see what it is that we need to do.
Actually, you can share it now because like I said, I am recording this.
Okay.
So if you
In the
like to
chat.
share your contact information, go right ahead.
Okay, so I will but my again my name is Shazaib Shakil. So my email it's my legal name. So I'm gonna you want me to put it in the chat, you think?
Just spell it out because the chat they're not going to be able to see.
Okay. Okay. So email it's SHAHZ as in zebra, AIB as in boy. So Shazaib is my first name, then period or dot. Then my last name, it's SHAKEEL, Shakil. So Shazaib dot Shakil at ssa.gov. Okay. And my phone number, I'm going to wait to share that with you next week because we are going through some phone number changes where my extension is changing tomorrow, literally. We're
Oh,
switching to Amazon Web Service based phone calls. So we're going through a big transition in regards to that. So I gotta update my business cards. I gotta update everything with my phone number. But I work at the office on 52nd in Ashland. So for the folks who are in Chicago, so I'm usually there if I'm not out running and doing an event. But yeah, please email me if you have any issues or questions or need me to explain something again. I'd be more than happy to do that.
okay. So can we do this on air that you'll come back every month and do this like Josephine used to do?
We could
Just different
possibly,
topics, different
we could possibly,
topics.
yeah, I can try to book the next few months with you. So
Okay.
we'll
Different
talk.
topics, and that way we can linger it on and
Yeah, yeah,
delve
definitely. 'Cause
deep into it.
spousal benefits, widow benefits, children's disability. There's a bunch of stuff I can talk about. So, yeah, we'll be in touch, and then we can definitely set something up.
Okay.
Yep,
All right, that sounds wonderful to me. And I just want to say thank you again for coming on. I
no
want to thank
problem.
everybody for chiming in, asking questions. I will upload this video for those that missed some of it, if not all of it. And let me come off